decided to write my analysis papers on some levels of practice in the EMS medicine around the world. So I decided to write about the EMTs, AEMTs, and paramedics, what the level of practice are, and what this knowledge, the scope of knowledge, let them do on the field, and how do they treat the patients. So as we already know, there are different levels of practice of medicine in the EMS services, and the scope of practice that it is applied. I believe that it will divide those in like three main different levels, which in them they are included. For my point of view, the first one that will be the EMTs, called emergency medical technicians. So I'm gonna explain what they can do in the scene and what procedures they can perform on the patient. So in the community of EMS, that is like everyone is really important, no matter how much they can do or what can develop on the scene. The EMTs develop the basic practices on the patient to care for them about. The level of practice of the scope, as we already know, the EMTs practices are developed in the ambulances. They are clinical trained to prompt and develop an efficient response to different calls and assist all the related medical issues that a person can present. Some of the main things are they are performed as DMT on the field. EMTs are like well prepared for a cardiopulmonary resuscitation, CPR, as we all know that about it, and they assess the medical needs of the patient. So they do a medical assessment on the patient. That's what I want to say. And this is provided that is in they can provide an aid on the emergency with some drugs as well that could involve like on the medical emergencies. And then their main thing that they do is they had to stabilize the patient at the scene before they take him to the medical facilities. When the patient is stable on the scene, the duty of the EMTs is to promptly transport the patient to the emergency medicine room and drive the emergency vehicle safely and keep an eye on the outcome of the patient. Now, the role of the advanced EMTs in the health professional, the primary focus is to assess the patient, and from their standard scope, they focuses on advanced knowledge on the skills they perform and they had to perform correctly to provide good attention to the patients. AEMTs facilitates the access to different levels of care when the patient surpasses what it's on their practice scope. Have additional preparation than the EMT holds. This might be important to take care of the patient to receive care at the scene. Being at the EMT on their scope of practice, they might carry more risky procedures, and if it is not made correctly and safely, they can put the patient at risk. So what basically the AEMTs do, they have a like deeper knowledge on how to practice the medicine and how to perform the skills at the scene, and their knowledge that will be more in depth too. So now, on the paramedic side, I believe the paramedics are they are the most highly trained person working for our pre-hospital scenes. Paramedics can administer can administer drugs and perform some invasive procedures on their patient to ensure the stability of the patient and make sure they get well to the hospital. They may need to make your heart beat fast or beat slower or maybe just harder, and then I can administer antidote drug for an overdose. Or maybe they can just put you asleep and paralyze your breathing muscles in order to place a life-saving breathing tube. Paramedics are the hands of the doctors on the pre-hospital scene. And they can make several interventions in the patient to ensure the stability. Paramedics can answer to medical causes like heart attacks, allergic reactions, labor delivery of the baby, and some complications like shock. Some disease situations, paramedics can administer different types of medications to the patient to get them to the hospital in better conditions. Those paramedics involve many hands on the patient, and they are more experienced than the EMTs or the AEMTs, and they have more knowledge practices. So it's like we can call them like doctors in the field. They can start ABs and perform advanced airway procedures to ensure the patient airway stays patent and open. And then from overall, those three stages, I believe, they are like the really most important in the pre-hospital scenes. They can take care of the critical patient, and from my point of view, they can save someone's life to be the first one getting on the scene and performing some procedures on those patients first. And then nothing of this can happen if they didn't gain confidence and competence to administer life support assistant. And that's why they are playing a big role in the system. So we can all we call them the first aid. But like I said, they don't care who the patient is or who they are coming from. The mainly point that they are trying to see is make the patient feel better and try to save their life. It is like if their life is on risk. Thank you.